The topic for this lecture is significance and its importance to statistics. We're going to talk about what significance is, why it is important, then we'll talk about how we can determine significance, and finally we'll talk about the difference between statistical significance and clinical significance. First, we need to cover some background information. Significance in the general sense means importance. When we talk about significance in statistics, we mean probably true. That is to say, it's not due to chance. In statistics, when we say something is significant, we are saying that it is probably a true finding and not due to sampling error or due to chance. We need to note that there is a difference between statistical significance and clinical or practical significance. For the first part of this lecture, we're talking about statistical significance, which is referring to the significance of a specific statistical test that we perform. Remember, statistics is about probability. It's not about certainty. We can never really know for sure the true state of things because we're not sampling the entire population. We're dealing with samples. Because of that, we have to set a threshold for where there's a low probability of getting the result that we got if our null hypothesis is true. You have to ask yourself, can you live with a 10% chance that your decision is wrong? What about a 20% chance that your decision is wrong? The point used by most researchers is a 5% chance, and that's what we're going to set our significance level at. So if we find a result that is significant, we're basically saying that there is a 5% chance of getting a result as extreme as our result if the null hypothesis is true. A significance test is a formal procedure for determining whether or not our results are likely due to chance or if this is an accurate result that we are seeing. So this is an effect of our experiment or this is some sort of effect that we're observing in the natural environment. We do this by comparing the p-value to the significance level or comparing the test statistic to the critical value. You only need to do one of these two methods for any given statistical test that you perform. But there are two different methods for determining significance, so we will talk about and learn how to do both of those. So first, some terminology so that we know what all of the terms are and what they all mean when we start to talk about how to actually perform those tests. First, our significance level. This is the threshold that you set to determine whether the outcome you observed is due to what you are measuring rather than due to chance. So this is that threshold or cutoff point that we were talking about. This is represented by the Greek letter alpha. The next term is p-value. The p-value is the probability of obtaining a result equal to or more extreme than what was actually observed if the null hypothesis was true. Okay, so think about that for a second. It's the probability that you would get a result equal to or more extreme than what you got on your test if the null hypothesis was true. So a small p-value means that there is a very small chance that you would have gotten your result if the null hypothesis was true. So a small p-value gives evidence against the null hypothesis. We can remember this with the phrase, if p is low, the null must go. So we have another video here from Dr. Nick about understanding the p-value. I suggest that you take a few minutes to pause the lecture and watch that video or do it when you're studying. This video will give you a lot more context about the p-value, and of course she has a chocolate example that she uses to illustrate how we use the p-value in hypothesis testing. The next term we're going to talk about is the critical value. The critical value is the value beyond which any outcome that you get is so rare that we're going to conclude it is not due to chance. This is actually a true finding. This is an effect of our intervention or experiment, or this is something that we're observing in the natural world, but this is a true finding. So the critical value is that threshold point. So here, my critical value is 1.96. Any result beyond 1.96 is so extreme I'm going to conclude that it is not due to chance. It is actually an effect of what I am trying to study. We can abbreviate the critical value as CV, and sometimes you will see it abbreviated that way. The rejection region goes along with the critical value. This is the range of values that would lead a researcher to reject our null hypothesis. This can be represented as area underneath the curve. So we have rejection regions here, on this side, and also on this side. There's rejection regions in both sides of these because this is a two-tailed test, or we have a non-directional hypothesis. If we had a directional hypothesis or a one-tailed test, there would only be a rejection region in either the upper end of the tail or the lower end. We would not have one in both. Here's a video on critical values that talks about what they are and gives some examples of how to use it. It actually goes through all of the steps using critical value in hypothesis testing. So this is a great video to watch at least the first minute or two right now, and then go back and watch the rest of the video when you're studying. This is one by Stephanie Glenn, and this video is about 7 minutes long, so it's a little longer than the ones that we normally use, but it does have really good information on how to use a critical value for hypothesis testing. Our next term is test statistic. Sometimes this refers to the test or formula that you use in your test. So if you hear test statistic or test statistic formula, this is asking about the formula that you're going to use or the type of test that you're going to use. But when we actually put in all of our values to that result and get a value, that's going to be called our test statistic or obtained value. It's a value that's computed based on data from our sample. This measures how far or how close we are from the value of the parameter specified by the null hypothesis. So a test statistic that's very close to the null hypothesis value would be small. A test statistic that's very large is going to be far away from the sample value, or excuse me, from the population value that's specified by the null hypothesis. Here's some of the different formulas that we could use for different types of tests. So we have a z-test using proportion. We have a z-test using sample data compared to the population. These formulas might look kind of scary at first, but if you start breaking down the individual components, you'll recognize that you've seen these before and you know what they are. So don't panic, just start breaking down the components. So even if I don't know exactly what the z-test is, I know that this is my mean for my sample, and I know this is my mean for the population. This is my population standard deviation, and this is my sample. So I know, or my sample size. So I know what all of these components are once you start to break it down. We'll learn about these different tests in the class, but these are some of the formulas that you would use for the different tests. So now let's talk about how we determine statistical significance. We have two methods that we can use to determine statistical significance. First, we can compare the significance level that we set to the p-value. Second, we can compare our test statistic to our critical value. Now you only need to do one of these for each given statistical test, but there are two different methods and you should know how to do both of them. First, using the p-value. To use our p-value to determine significance, we're going to set our significance level. Remember, this is done prior to analyzing data, can be done prior to even collecting data. It's one of our first few steps of hypothesis testing. We're going to determine our significance level. Then we're going to determine our p-value. We can do this by hand. We also can do this with the results from our statistical software, or we can use an online calculator. Finally, we're going to compare our calculated p-value to the level of significance that we set. So how do we decide on the significance level that we want to use? Well, this is set conceptually by the researcher, and it's based on the degree of risk that you're willing to take that you would reject a null hypothesis when it's actually true. Remember, there's no certainty, there's no 100% outcome in this situation. We're dealing with probabilities, and so we want to set a level where there is a low probability of getting a result that we got if the null hypothesis is true. Because remember, the null hypothesis is that there's no difference. And we're trying to prove that, yes, there is a difference between these groups that I'm studying. Conventionally, you would use a 0.05 or 5% chance. So our significance level would typically be set at 0.05 or 5%. There are situations where we might want to set a different significance level. If we're dealing with medical testing, for example, and we want to be really sure that a new drug works before we start to actually use that on a lot of patients, and we're comparing two drugs and looking for a difference between the two, we might set a higher threshold, but it would be lower significance level. So we might say that we are going to use 0.01 or a 1% chance of our statistic occurring if the null hypothesis is true. This means we're being more conservative. We only want to get really extreme results, which would really demonstrate to us that this is due to the effect that we're studying. However, the converse side of that is if we set our significance level at 1% instead of 5%, then we might actually reject or not reject our null hypothesis when it isn't true. So there's always a trade-off. We're trying to find that middle ground where we can accept the chance of rejecting the null hypothesis when it's true. And conventionally it's 5%. But there are situations where you would make a different significance level. So let's talk about calculating the p-value. Well, we can do this by hand. It's a little bit cumbersome. And really, we get this with the results of most of our statistical software. So in Excel, we can use functions to calculate the p-value. And we can also get this in the results of our analysis. So for example, we run a t-test and we get these results. So on here, we have two results for p-value. Well, take a look and see which one you think you'd want to look at. Well, it really depends, right? If we have a non-directional hypothesis, we're going to look at the two-tail p-value. And if we have a directional hypothesis or one-tail hypothesis, we're going to look at the one-tail p-value. So we just look right here in these results, and it's given to us when we run this test. Other statistical software will typically give you the p-value as a result also. There's also online calculators that we can use where we put in our parameters from our test, and those will give us the p-value. How do we decide when the p-value is too small and therefore we should reject the null hypothesis? Well, remember, we're going to compare the p-value that we get to the level of significance that we set for our test. So if our p-value is greater than the level of significance, we will fail to reject the null hypothesis. If the p-value is less than or equal to the level of significance, then we reject the null hypothesis, and we're going to conclude that our test is statistically significant at that level of significance. In our statistical conclusion, we always want to state the level of significance that we used. Typically, we're going to use 0.05, but we could use 0.10 or 0.01. We really could choose any level that we wanted to, and at a different level, our result might be different. So for example, if our p-value is 0.04, that is going to be less than 0.05, so it would be significant at the 0.05 level. But if our significance level was 0.01, 0.04 is greater than that. So because we can choose any level of significance that we want, we need to specify what level of significance we use for this statistical test. So our statistical test is going to state either that we fail to reject or that we reject the null hypothesis and what significance level we use for that result. Now, our second method of determining significance is to use a critical value. To use a critical value to determine significance, we're going to set the significance level. Remember, this is done prior to analyzing data. We're going to calculate the test statistic or our obtained value. This is done after we analyze our data or while we're analyzing our data. It's value that is computed from our sample data. Then we're going to determine our critical value. We can look that up in a table, or we can use an online calculator to give us our critical value. Once we've determined our critical value, we're going to construct our region of rejection. Finally, we're going to compare the critical value to our calculated test statistic, and that will enable us to make our statistical conclusion. We're going to talk about each of these steps a little more in depth now. Okay, so calculating our test statistic. We can do this by hand. We would take the formula that we're using for our test, and we would plug all of the values that we got for our test into that formula and get our test statistic. We can also get this as results of our analysis in Excel or another program that we're using. So when we run our test, this is that same test we looked at before, the t-test, we get results that tell us our t-statistic. This is our test statistic for our test. It's negative 2.59. To calculate our critical value, we can do this either by hand, by looking in a table, or using an online calculator. The calculator that you use will vary for each statistical test. There's a slightly different method for determining the critical value based on the test, so just be aware of that. But I am going to go ahead and show you how to find your critical value by hand, and then also an example of finding the critical value using an online calculator. So here we have a critical value table, and in order to use this, we need to know a few things. We need to know what our degrees of freedom is. We also need to know if we have a one-tail or a two-tail test, and we also need to know our significance level that we're using for our test. So the first thing is our degrees of freedom. Remember, degrees of freedom is going to be sample size minus 1. We do have a few tests that use a different formula for degrees of freedom, but we'll learn about that as we go. For now, we'll just use the basic formula, which is sample size minus 1. So if, for example, we had a test with a sample size of 10, our degrees of freedom would be 9. So to find our critical value, we would go to the row for 9 and look across that row. Now, to know which column to look in, we're going to come to the top of the table, and we're going to choose whether we have a one-tail or a two-tail test, and then we're going to choose our significance level. So if we have a two-tail, which is a non-directional test, we're going to come to the 0.05 level, assuming that our significance level is 0.05, which is kind of that standard, so we're going to use that for now. And we would go down that column till we find where it intersects with 9, which was our degrees of freedom. So our critical value for this test is going to be 2.2621. Now, if we have a two-tail test, this is going to be plus or minus 2.2621. If we have a one-tail test, it's only going to be the direction that we're looking for the difference, greater than or less than. But with a two-tail test, we have rejection region in both ends, so it's going to be plus or minus 2.2621 that would become our critical value. So if we wanted to use an online calculator to determine our critical value for us, we would still need to know what our probability is, our alpha level. We're going to enter that in here, and it will tell us what our critical value is. Now remember that the online calculator that you would use would depend on the specific test that you're using, because we have different tables for every test that we would use. There's a slightly different method for determining it. So be aware of that and make sure that you're using the appropriate online calculator for your test. But the basic principle I want to show you here is that our significance level matters because that helps determine what our critical value is. We've just seen how to find your critical value both by hand and using an online calculator. I went ahead and linked this video in here again because she shows you how to use a table to find your critical value, and she goes all through the examples of using your critical value to determine significance. So it's a great refresher video if you want to review that when you're studying. Once we have our critical value, we're going to compare our test statistic that we computed to that region of rejection. So remember, I found my critical value. I need to construct my region of rejection. And bear with me, I'm going to try to draw here and put what our region of rejection is. So I have my curve. We'll pretend that's a straight line. It's not too bad. This is my middle, and my critical value that I found was 2.26. Okay, so 2.26. And remember, this is a two-tailed test, so this is going to be plus and minus 2.26. Since you're watching this at home, it's okay for you to laugh at my drawing because I won't be able to hear you. My daughter laughs at my drawing too, so it is definitely okay. So my critical value is going to be plus or minus because this was a two-tailed test. So let me do my rejection region, just pretending that that lined up. So it's going to be anything beyond this point and anything beyond this point. So it doesn't matter if your drawings are exactly to scale. This is really just to help you visualize that rejection region and whether or not your test statistic is greater than or less than. So it doesn't really matter. Nobody's judging you on your drawings, thank goodness. Okay, so remember the test statistic that we got for our test was negative 2.5. We saw that in our results from our Excel analysis. We had that output and it said negative 2.25. So I probably don't have enough room to write all of that there, but we'll try. So this was our test statistic. So I'm going to compare it to my critical value and determine if it's greater than or less than my test statistic. And when I say greater than or less than, what I really mean is more extreme. I'm looking for a result that's beyond 2.26 or beyond negative 2.26. So I'm really looking for a more extreme result than either of my critical values. And in this case, I do have a more extreme result, and it is in the rejection region, which means I would reject my null hypothesis. But let's go to the next step, which is making our statistical conclusion. So for our statistical conclusion, we're going to compare our test statistic to the critical value. If it's less extreme than our critical value, we will not reject the null hypothesis. If it is more extreme than our critical value, we will reject the null hypothesis, and we'll conclude that the test is statistically significant at that level of significance. So remember, we're always going to state what our level of significance was because a different critical value would be given if we had a different level of significance. So our level of significance makes a difference in our determination, so we always need to include that in our statistical conclusion. So statistical conclusion is this test statistically significant at the level of significance that we set? So we just, for this method, just compare our test statistic to our critical value. If it's more extreme, we reject the null hypothesis. If it's not as extreme, we do not reject the null hypothesis. And I really like to draw it out like this as a way of just visualizing that for yourself. You can also just set it up with little greater than or less than signs if you wanted to, but drawing it out makes it easier for me to make sure that I'm looking at the right thing and making the right conclusion. So now we've learned about the two different methods that you can use, the p-value and the critical value. Well, that begs the question, which one should you use? Remember, I said you only need to use one for any given test. You just need to use the p-value method or the critical value method. So, which one should you use? Oh, Martin wants to be picked so badly, doesn't he? Poor Martin. Well, it doesn't really matter because you'll get the same result either way. And when I say you get the same result either way, that isn't to say that you'll get the exact same values because you're looking at different things. but you'll get the same result in either determining to reject or not reject the null hypothesis, whether you use the p-value or the critical value. You would not have a situation where you use a p-value and determine it's significant and look at the critical value and it's not significant. Those findings will be consistent. Most of the time, people are going to use the p-value. And the reason for that is that people are pretty familiar with the p-value and the p-value concept. We're used to hearing about it. We're used to seeing it reported. But also from a practicality standpoint, the p-value is given to you in the results of your analysis when you run a test in Excel or other software, and you can just look at that and the significance level and compare it a lot easier than having to know the test statistic and the critical value. So from a practicality standpoint, most of the time you're going to use the p-value. Once we've determined significance, we're going to state what our statistical conclusion is. So after we have either compared the computed test statistic to the critical value, or we compare the p-value to the level of significance, we either reject or fail to reject the null hypothesis. Some people will use the phrase accept the null hypothesis. I personally don't like that phrase, so I like to say that we fail to reject the null hypothesis. The reason is we have no certainty in statistics. We're dealing with probabilities and likelihoods based on the findings that we have and what we know about our population. The fact is, our decision could change if more information comes forward. So we never really know the true state of things. We just are making decisions based on the best information we have available at that moment. And so for that reason, I like the phrase fail to reject the null hypothesis. And then also note that your statistical conclusion is based off of calculations you've done during your testing process. So here is an example of how we might phrase our statistical conclusion. Since the p-value is less than the level of significance, we reject the null hypothesis. And sometimes you'll just see it reported in a paper as p is less than 0.05 or some other number. So this means that it was less than their level of significance. It's more accurate to actually list what your p-value was. And so in addition to saying it's significant, when you write up your results for a paper or something like that, you should also state what the exact p-value was. So lastly, we need to talk about statistical versus clinical significance. Statistical significance is what we've been talking about. It's the probability that our findings would occur if the null hypothesis was true. This gives us evidence to reject the null hypothesis, and we determine it either by comparing our p-value to alpha or comparing our test statistic to our critical value. On the other hand, clinical significance, which could also be called clinical importance, practical significance, or meaningful results. Typically, you're going to see that called either clinical significance or practical significance. This is concerned with whether or not this effect really means anything. Is this effect enough to change the way that I'm going to practice? If I'm a doctor, will I change the way that I treat my patients based off of this? If I'm a health educator, will I change the way that I educate people based off of this? So is this result important enough to actually change how things are being conducted in the real world? This is a matter of judgment based on your personal experience with the topic and just your subject matter knowledge. So it's important to note that a study could be statistically significant but not very meaningful. So we could have a statistically significant result, but the difference between our groups is really so small that it's not really that meaningful. Also, we can only interpret statistical significance in the terms of the context that it occurred. So it's only going to apply to the test that we did at the level of significance that we ran that test. And statistical significance is not the only goal of scientific research. Although researchers do want to find significant results, it's not our only goal. Sometimes finding that things are not significant is also very important. I did a study looking at cesarean section deliveries among women with gestational and pre-gestational diabetes, and I was trying to predict whether or not they would have a cesarean section delivery based on personal characteristics. Well, my results weren't significant. That means that the weight of the mother, her blood sugar readings, things like that were not predicting whether or not she would have a cesarean section. And when I dug into the data a little bit more, I found that most of the cesarean sections were planned in advance, and there weren't necessarily medical reasons other than diabetes to do the cesarean section. So this told me that physician practice patterns were actually more important than the physical characteristics or the biomedical characteristics of the patients. So sometimes when you find results that aren't statistically significant, you can dig a little bit more and find something else going on that you hadn't expected. The last thing I want to note here is that statistical significance is influenced by your sample size. So the larger the sample you have, the more likely you will find a significant result of some kind. I'm going to show you an example of that here in just a moment. So I have a significance calculator here, and significance calculators are going to also vary based on the test that you're using. So this one is for a correlation, which is the relationship between two variables. And I just want to use this to illustrate the effect of sample size on significance. So if my correlation is 0.4, that's pretty moderate. And my sample size is 15. And my significance level is 0.05. Let me calculate that. My p-value is not significant. It is greater than 0.05. Okay, so what about if I have the same parameters except for a larger sample size? So let's try 25 for my sample size. Well, this is significant. My p-value is 0.04, and that's going to be less than 0.05. What's going to happen if I have 50 people in my sample? My p-value is 0.0004, which is even lower than my one I just got, which was 0.04. So because the formula to calculate significance, to calculate the p-value, takes into account sample size, as I increase my sample size, I'm increasing the chances that I'm going to find a statistically significant finding. If I have a really large study, I'll probably find some statistically significant finding just because I have so many people in my study. But sometimes those differences are really small. And then also the more people you have, the smaller differences you can detect. If I only have 50 people, I'm not going to be able to detect a very small difference between my people. But if I have 10,000 people, I would be able to detect that difference because I have so many data points to be using to find that. Okay, so just remember as you do research and interpret results, the larger the sample, the more likely you'll find a significant result. Now let's talk about clinical significance a little bit with an example. So for example, a large study might find that a new antihypertensive drug lowered blood pressure on average 1 millimeter of mercury more than conventional treatments. These results are statistically significant. However, most clinicians would not find a 1 millimeter mercury difference in blood pressure large enough to justify changing to a new drug. So even though the results were statistically significant, they're not going to be really clinically significant. So that means that we have statistically significant results, but the effect is not enough to make clinicians change the way that they are practicing or treating patients. It's just really not that significant to their practice. So here's a scenario I want you to think about. Researchers are testing a new drug to treat cholesterol. People who take the current gold standard drug Reduxa have an average cholesterol level of 210. Researchers conduct a study and find that people who take the new drug, CholReduce, have an average cholesterol of 205. This finding is statistically significant. Reduxa costs $2 per pill. Because it is new technology which is patent protected, CholReduce costs $10 per pill. All other things about the drug being equal, do you think this finding is practically significant? There is a statistically significant difference, right? But the practical difference is pretty small. If you were a doctor, based on this information, would you recommend that your patients take CholReduce instead of Reduxa? I think that probably depends on some other factors. If getting that 5% reduction or 5-point reduction in cholesterol was really important to a particular patient, then you might, but also consider the cost of the pill. If you have somebody that's paying out of pocket for their prescription, or their copay is based on the cost of the prescription, they might not be able to afford something that costs 5 times as much. So that might not be a practical solution for them. So based on this information, doctors probably are not going to change the way that they're treating patients, and this is probably not a practically significant finding, even though it is statistically significant. Some considerations that we need to take into account with significance are sample size. Like we talked about, larger samples make it more likely that we can reject the null hypothesis. Also, the smaller the value of alpha, the more difficult it is to reject the null hypothesis. When we're setting a lower value, so 0.01 instead of 0.05, our result has to be even more extreme. And we talked about how there are some situations where that might be warranted. With a non-directional hypothesis, remember that you have regions of rejection in both ends of the distribution. So our region of rejection is going to be positive and negative end of the distribution. But a directional hypothesis has a region of rejection in only one extreme of the distribution. This is a one-tailed test. So in this case, we only have a region of rejection in the upper end of our distribution. We're just looking for a difference that's greater than. We want it to be greater than. And that's all we're looking for. So I want you just to take a minute and ask yourself if this all makes sense, if there's something else you need to think about or look at a little bit more, and go back and study that for yourself. I also have some additional resources here on understanding the p-value, the critical value, and then some important statistical concepts, which include those concepts and the concept of significance. I also have a critical value calculator and a z-test calculator. So hopefully with the lecture and with these additional resources, there's enough here for you to understand a little bit more about significance and why it's important to statistical tests.